My name is Dr. Chad Wheeler. I am a board-certified plastic surgeon and one of the co-founders of Plastic Surgery Northwest. I specialize in breast reconstruction as well as cosmetic surgery, including face and body. I'm probably mostly known for my deep plane face and neck lift, as well as my hourglass lift, which is a lower body lift with flank liposuction and gluteal fat transfer to restore the female hourglass figure following pregnancy or weight loss.
So let's go back to the beginning. How did you grow up? And were there any early experiences or influences that led you to kind of go the medicine route and then eventually end up in plastic surgery?
Yeah, so I grew up in an Air Force family. So all of the males in that side of the family were in the Air Force, and I have a problem with authority. So I knew that that was not the path for me. So I did not want to go into the Air Force. When I was in ninth grade, I grew up just loving to do art. That was my thing. I was in my art class in the ninth grade, and somebody said to me, if you don't provide the same quality of life of what your family provided for you, you will not feel like you're successful in life. Now, whether that's true or not, I don't know, but I took it to heart then. And so I didn't want to grow up and be a starving artist. I was used to an upper middle class kind of upbringing. And so I was like, okay, what can I do with my hands that would provide a quality of life for my family? At the same time, I was taking science. And so they offered extra credit if you could get the brain and the spinal cord of the fetal pig out in one piece. So I would come in at lunch and work on that. And I kind of enjoyed doing that. And it was working with my hands. So I was like, well, maybe I should be a surgeon. And then I thought, well, what's the most artistic surgeon? How about plastic surgery? So in ninth grade, I decided I was going to be a plastic surgeon. All of high school, all of college, all of medical school, I knew what it was I wanted to do. Now, what I found out was that plastic surgery is literally the hardest specialty to get into, period. So if you want to do it, you have to be the absolute top of everything to get in. At the time I came through, there was only about 87 spots in the country for people graduating from medical school who wanted to go into plastic surgery, and nobody from my school had ever made it into plastic surgery. So I ended up interviewing at 22 different places all over the country. The closest place to me, I went to medical school in the University of South Florida in Tampa. The closest medical school at that time was Wake Forest, about 900 miles away. So I knew I was going to travel no matter what. And so came out to Seattle, which had a really good residency program when I came through. Just fell in love with the Northwest and ended up getting it. And that brought me out here. And from there, I met Dr. Williams, who's one of my partners here. And she and I together decided that we wanted to go into practice together. It was 2009, and it was the Great Recession, and nobody was hiring. So we, as residents, put together a pitch. And so we went around to hospitals throughout the Northwest and talked about the advantages of having two plastic surgeons together and how we could do more complex surgeries and support one another and that sort of thing. And we ended up getting offers from about 3 or 4 different hospitals for us to come and do our thing. And one of them was in Spokane. And so we ended up coming here and starting this.
So you kind of walked us through the early part of your medical career or how you got to where you are. Were there any specific moments during your medical training that have kind of shaped who you are as a surgeon today?
It's hard to put your hand on one particular thing. The experience you have, especially training at the University of Washington in Harborview, it's an insane experience. You don't know anything. You're working, 30, 40 hours a day, more than a day, right? I remember holding the general surgery pager as an R1 and having 47 consults to go see. And that's just ridiculous. You definitely learn a lot very quickly, but I wouldn't say there's this one moment was a whatever. I kind of already knew what I wanted to do and how I wanted to do it. What I love about plastic surgery is that for the most part, you're taking care of people who are very invested in their experience. Unlike a lot of other parts of medicine where somebody just wants a pill to fix their problem and they don't want to take ownership for anything. In this particular scenario, it's usually somebody who's worked really hard to get to something. They've lost all this weight through diet and exercise, or they've had changes in their circumstances, like maybe they're getting a divorce and they want to feel better about their body or themselves. And so they're all in, right? They're paying lots of money out of their own pocket to get this thing that they really, really, really want. Having somebody who's a partner with you when you're trying to do their surgery is really helpful, as opposed to somebody who's basically undermining you all the time. If you go into vascular surgery, patients oftentimes are smokers, and that's why they have all these vascular problems. And so they need to quit the nicotine, but they won't. And so they keep having all of these issues, and you're trying to do surgery to help them, but they're not helping themselves. And that's just really frustrating. And it's one of the things that frustrates a lot of doctors about medicine is that, the patient themselves aren't invested in their own health. By being on this side of things, it's easier. I don't dread coming to work every day like a lot of doctors do. I enjoy my job. I enjoy my patients. I enjoy working with them as a team and coming up with what we can do that is the best thing for them.
What is one of the most impactful patient stories that you've experienced so far?
Some of them, like if you try to talk about them, you'll get pretty emotional. So like I have to be careful of which ones I talk about. And clearly the most impactful one was what happened with one of our partners. And that was a very life-threatening situation that was very challenging for me. And most of the stories that are really impactful are actually sad. So like I don't want to tell those. I would say I have a patient who I've done everything to. She came to me for weight loss initially, and we were planning to do a tummy tuck and that sort of thing on her. She ended up getting breast cancer before we were able to do that. And so then we were able to use her lower abdominal skin and fat to reconstruct her breasts. That's called a DIEP. We're one of the few places in the country that does those. So I did her breast reconstruction, and so that made her abdomen better. So then she didn't like how her buttock looked because she had lost like 140 pounds. And when you lose that much weight, you kind of look like a melted candle. So we ended up taking off all of the skin and fat from her back to like lift her butt up and lift her thighs up. Then she didn't like her arms. And it's not like she has a body dysmorphia or something like that. When you look at her, you're like, yeah, I could see why you don't like your thighs or your arms or whatever. That's just what happens when you lose that much weight. So I ended up doing a brachioplasty, which is an arm lift on her, a thigh lift on her, and a facelift on her. She's just the most amazing person. She's so like you took this person who was like sad at life and just turned her into a totally different person now. And it's just every time I see her, it's very rewarding. I've known her now for like 10 years, to have that much of an impact on someone's life.
Yeah, making an impact is important. And that kind of leads me into our next question. What makes you feel like you are successful at being a plastic surgeon?
Well, there's the obvious things, right? Like, the building we're in, the thing that we've built, the fact that we have like almost 80 employees at this point, the financial success, of myself and my family. But it really is about the difference you make in patients' lives and how they, when you pick the right patient, you do the right surgery and they get the result that they expect and that you expect, you've changed their life forever, right? And that's a very impactful thing to be able to do that and use my artistic gifts, right? That, yes, I could go sculpt some sand or paint a painting or whatever the thing is, but that's not necessarily going to change someone's life. And so I think using my gifts to impact people is a very good way of having an impact on society, even though it's only one person at a time.
You spoke already to the artistic side of this and how plastic surgery really, it's an art, it's a craft. How do you stay up on the research and the new techniques to keep you top of plastic surgery?
Usually it's going to conferences. I actually learned how to do the deep plane facelift by going out to Dr. Nyack in St. Louis and watching him do it, watching videos of surgery, that sort of thing. It's mostly just talking to my colleagues, talking to other people who I respect in our community that do a great job, learning what they will learn. And luckily, a lot of them are very willing to teach what they know, as am I, to help people, do the right thing for the patient.
And you're not just a surgeon here. You are also an owner at Plastic Surgery Northwest. So tell us why it's important for you to have this leadership role here and kind of what that looks like for your practice.
Over the years, so initially it was because I don't respect the authority. And so I wanted to be in charge because I can't stand doing something that I don't agree with. It just drives me crazy. And so initially it was for that purpose, to be able to be in charge so that I can kind of live with myself. As the years have gone on and we've gotten bigger and bigger, it's this push and pull of trying to make sure the company's headed in the direction that you want it to head, but at the same time not being stuck in the day-to-day. And, that's really challenging.
What are you hoping to take into 2026 as a surgeon here and then also a leader here at Plastic Surgery Northwest?
We opened Plastic Surgery Northwest 16 years ago. It's grown exponentially. The only thing I say to our employees when they start working here is like, if there's something you don't like about something, don't worry, it will change. Because it's constantly been changing from this podcast studio to so many things. So I would say in 2026, I just hope more of the same growth, slow, steady rise. There's not a specific goal that I have in mind for us in 2026 other than just, trying to keep going with what we've been doing.
So you have quite a following on social media, and that is one of the ways that patients can connect with you and see the work that you do. How else can future patients get in touch with you or potentially schedule a consult?
I would say social media is their best way to get in touch with me. I'm on it every day. I will usually a couple times a month, ask me a question on my social media so that they can, literally the same day, I will answer your question in a video. They can direct message me through there, and I set them up. Obviously, they can just call and ask for a consult. But I use social media a little bit differently than most of my other partners in that I'm really out there showing my personality. I have a very distinct personality that's very direct, and some patients, whether they know it or not, they don't really like that. Everybody says they like direct communication, but when you get direct communication like I give it, it can be seen as offensive sometimes to somebody, especially when you're talking about a part of their body or their face or whatever thing that they're already insecure about, right? So like if you come in and you don't like your wobbly neck, and then I start talking about your wobbly neck, I'm not going to pat you on the back and tell you, no, it looks great if it doesn't look great, right? If you're insecure about it and you don't like it, and I see the same thing, I'm going to validate those concerns and talk about how we can fix it. That's not how society really works, right? Normally you say, oh, I hate my nose, and everybody talks to you about how cute your nose is, right? Even if it's not cute. So that's a very different approach that people are kind of a little bit like shocked about that. So I find that the patients who have looked at a lot of my social media or seen my personality, they're prepared, for what I'm going to say. They know I'm not going to do the typical, politically correct thing with them and talk to them about how they don't need this, right? On the same token, if you come in and you have D-cup breasts and you want a breast augmentation, I'm going to tell you why. You already have plenty of volume. Having triple D breasts is going to give you neck pain and back pain and all sorts of other things. So I say no to about 20% of the patients who come in and see me because I don't validate what it is that they feel about their thing, or I don't think that I can improve that in a way that's going to make them happy. And that's part of your job as a plastic surgeon, is to help people filter out like what is an unrealistic expectation and not operate on some people because it's just they're not going to be happy with it. Michael Jackson had 5 nose jobs from what I can tell, and he wasn't happy with any of them. So that's an example of body dysmorphic disorder where somebody thinks that there's an issue and there really isn't. If you look at him after his first or second nose job, they both were pretty good. Taking his African-American nose and making it smaller and more Caucasian, which is what he desired, then it just went over the top and was way too small and looked crazy and stupid, and he still was never happy with it to the point that he wore a mask. If you operate on somebody who has body dysmorphic disorder, they're never going to be happy. Now they're mad at you, and they still hate their, whatever they decided to focus on.
Okay, so to wrap this up, tell us about how patients can get in touch with you.
Sure. So if they're interested in coming in to see me for a consultation, they can find me on my social media. I am Dr. Dr. Wheeler. My last name, PSNW for Plastic Surgery Northwest, is my Instagram handle. Our website is plasticsurgerynorthwest.com. There's before and afters that are on there that they can look at, or they can always, I know this is going to be a dirty word, but they can always call, and our phone number is 509-838-1010, and ask for a consultation with us.
Perfect. Thank you.
Yeah. Thanks for having me.